So today's my session is on elective. At first, I'm very sorry for the technical problem. So we are dealing with the competency-based medical education in forensic medicine, and there is difference between the competency-based medical education and the traditional medical education. Some new learning experience has been included in the competency-based medical curriculum. The example of that is what the Pratik sir has taken about the foundation course. Then there is early clinical exposure. Then there is electives. Then there are skill training. Then student doctorship. So these are the different new learning experiences that has been included in the competency-based medical education. Today, I am going to elaborate on the electives. So I have divided this topic into first the introductory part, some definitions related to the electives, and afterwards how this elective should be planned at the institute level, and after that how the it should be implemented. So the graduate medical education rules, which are published in 2019, in that ideal way these electives are planned after the examination of third M.B.B.S part 1 and before commencement of third M.B.B.S part 2. So usually or in ideal time it was scheduled in November and December, but due to this corona pandemic and the just before this Dr. Pratik sir has shown the new timetable, but that timetable is also tentative. So usually this MCA wants after the third M.B.B.S part 1 examination and before start of third M.B.B.S part 2, and 2 months are given, that is the November December, but it is going to change in a new now this era due to the corona pandemic. Then introduction, next slides please sir. So what is elective? Electives are the learning experiences that will provide the learner with an opportunity to gain immersive experience of a career stream, discipline, or a research project. So in this, it's a very innovative idea, and they have given 2 months, one and made two blocks. So if the student is interested in a cardiology, so he will do his 1 month elective at a cardiology. If he is comfortable, he has seen, he got the experience about the cardiology within 1 month, then he or she will introspect, is he or she suited for that cardiology department or not. If he thinks it's very good and I can make career in a cardiology, then he can do a study and get a goal oriented that he must get the cardiology. Like this, he will get that experience at the UG level only. Same time, it may be vice versa. The student does not like, or he thinks that I am not suited for the career, so he can change his mind and give or alter his mind and can concentrate on another subject. So that is the beauty of the electives. So those at the UG level, he will get the experience of a specialized training. So that's the more important and the beauty of the elective. Next slide, please. So my session objective is the participant must be able to develop elective for block 1 and block 2. Next. So what is the definition of the elective? So elective is an learning experience created in the curriculum to provide an opportunity for the learner to explore, discover, experience areas of streams of his interest. So I have already given the example of the cardiology. So what is block? Block is defined as a time period during which that learning experience are created in a particular subject, specialty or theme. that is the block. What is logbook? Dr. Bragnesh has taken very elaborative session on a logbook. So logbook is a verified record of the progression of a learner, documenting the acquisition of requisite knowledge, skill, attitude, or the competency. This word verified record is very important. So it is verified record by a teacher. That is the logbook, and how the logbook should be written and all these things has been taken in a previous session. Then what is portfolio? Portfolio is a collection of the learner's progression in a task and the competencies. So these are the important definitions related to the elective. That is about the elective, block, logbook and portfolio. The what are the objective of the elective? Why this MCI or now NMC wants to include that elective in a competency based medical curriculum? The first and foremost, that is for the diverse learning experience for the student, and to do research on community projects that will stimulate students inquiry, self-directed experimental learning and lateral thinking. Now this research is very important because at my level, when I was doing the PG, at that time I have taken the sample at the 100. So it's the usually, or you may see that in a clinical departments also, that they have taken 50 males, 50 males, but that's the wrong. What the basic purpose of the research? That whatever your finding come, that finding must be applied to all over the world. So your research must be the authentic. When your research will be the authentic, when you will design a proper research question, you will take or choose proper research design, then you will take a proper sampling. So how the sample size must be calculated, what are different equations for the sample size, what are different softwares like OpenEP. So if the student will get that opportunity at UG level, that these are the steps of doing the proper research, that is framing research question, choosing research design, collection of the data, then proper sample size. If he knows proper step at a UG level, then he will start, or his concept about the research will get clear at a UG level. Then afterwards he can do a quality research. So that's the important thing in a elective, and the student will get exposure of the proper research at the UG level only. So that's the very important objective of the elective. And it is, and the what's its importance in the curriculum, that is it is mandatory, and it is one of the eligibility criteria. If elective student has not done the elective, then he is not eligible to give the final examination. So it is the mandatory for the student, and the elective should not be used for the missed clinical posting, shortage of the attendance or other person. In short, that elective must be used for that purpose only, not to make up missed clinical posting, shortage of attendance and other purpose. So it is strictly, or that word mandatory is that it should be used for that purpose only. Next slide please. So what is the structure of the elective? So the learner shall rotate through two elective blocks of 4 weeks. So there are two blocks of 1 month. Block 1 will be in a pre-selected preclinical or paraclinical or other basic science laboratory or in a research. And the important thing or important difference between block 1 and block 2 posting, that in a block 1, as it is in a preclinical, paraclinical or research, the regular clinical postings shall continue, while block 2 will be for the clinical department, including specialties, super specialties, ICUs, blood bank, casualty, etc. etc. So what is the basic difference between the block 1 and block 2? That in block 1 there will be the regular clinical posting, while in block 2, as it is in a clinical department, so the clinical posting or all these things will be cool. So the clinical department, including the specialties, that cardiology, urology, gastroenterology, like that. If the student is interested, he will choose the elective of a block 2. So institution will have to predetermine the number and nature of the electives, name of the supervisor, number of the learners in each elective based on its local condition, resources available. Next slide, please. So institution will have to develop its own mechanism for the allocation of the elective. So the NMC has given the autonomy to that particular institute to allocate the elective to the student. It may be on a merit basis, or it may be first come first basis. Like that, institutes will choose how the elective should be allocated to the particular student, and list of whatever the electives the institution has been selected, that all should be made available to the learner in the beginning of the academic year. Means it should be available at the beginning of third MBBS part 1, and learner must submit the logbook based on both blocks of the elective, and that is the one of the criteria or of the evaluation or assessment of the elective, the logbook. I will come to that in a afterwards about the what consists of in a logbook. Then 75% attendance in a both elective should be there, and submission of the logbook is the eligibility criteria to appear the final MBBS exam. So that is very important, or importance is given for the elective. And if there is the time, then institution can use this time for the different skill certification. So you know that each subject has given a different skill certification. So if there is time, the student can go to the skill lab and do the different skill certification. Next slide. So how this learning experience should be planned. So these are the different steps of a planning of a elective. So define learning objective. So you have to, at first institution has to select different elective. Then each elective should have some objective, and these objective like a SLO, all the three domains should be included in the objective. That is your cognitive domain, your psychomotor domain, and your uh, at- attitude domain. So all these three domains should be included. Then identify different preceptor or teacher responsible for that elective. Then there must be pre-published timetable. So during this 1 month, what student is going to provisionally or tentatively do, that timetable must be available. Then during this, what learning resources should be there for the learner, that also should be available at that elective. Provision to be part of team to obtain immersive learning experience. Then there are some prerequisite. For example, if the student want to do the his elective in any lab, then there must be, he should must do the small course on a good clinical practice or good laboratory practice. So that also the institution should have to think how this small orientation program about good clinical practice, good laboratory practice, the institution should also has to arrange that before the commencement of the elective. Then how this elective should be assessed, what come under the formative assessment, that should be also be written in the template, and the program evaluation by the stakeholders. So that is the planning of the electives. So in each institution has to identify different preceptor or the different teacher for the each elective. So before starting, institute should think how many laboratories are there, how many preceptors are there, how many existing research projects are there. Like that, here the dean and curriculum committee, they has to sit, make the list of the elective, and like that, and that what are the electives are possible at the institute level. Also, there are another thing, that if that resources are not available at the institute level, then they can do the MOU with other external institute, and they can send their student to other external institute also. So like that, so institute has to identify minimum the elective, because if the your student capacity is 150 and maximum for that elective 7 to 8 student can be taken, then minimum at the institute level 20 elective sitting should be there. Like that, 10 for the preclinical, 10 for the paraclinical, like that, and then only the all the student can get accommodated. So like that, there should be the thorough discussion of a curriculum committee with the dean, how many electives should be there at a institute level, how then they have to assign a preceptor for each elective, then what are the different resources are required, like this, there then what are the different prerequisite, like small courses students should have to do, like this, there must be a thorough discussion, and all this, after that only they can make the elective. Next slide please. So this is the template for the planning learning experiences in elective. So first you have to write name of the block, block 1 or block 2, name of the elective, then location of the hospital or research facility, name of the internal preceptor if the college level, name of the external preceptor if that elective is at a another external institute. So you have to also identify external preceptor. Then learning objective, I already told that there should be all the domains must be included in the learning while you are framing the learning objective. The number of the student, that is 4, 5, 6, like you have to write prerequisite for the elective. I already explained on that. Learning resources, what are learning resources required, that should be available for the student. Then during these 30 days, what student is going to do, like that list of the activities, minimum 5 to 6 list of the activities should be there. So then portfolio entries required, logbook entries required, and how you are going to assess, that must be there, and other comments. So this is the template, and it will, I'm going to give this exercise to the different groups for the to make a template for a different electives. So this is the template. Now I am giving the example of the template. Next. So this is the exam. I purposefully not taken example from a forensic medicine subject. I have taken from a other subject because I know that only 2 or 3 groups are active. So I want to give this exercise to the other groups to make a template for the electives related to the forensic medicine subject. So the same thing, now I have taken the example of the medical genetics. So it comes in a block 1, name of the elective, medical genetics, location, medical your college name, medical college name, name of the internal preceptor in Mr. XYZ, like this, name of the external preceptor, it is in your college, so it's not applicable. Then what are the learning objective of the elective of a medical genetics? First, they are going to demonstrate the conduct of commonly available genetic tests in a controlled environment. Second, to enumerate indication for the common genetic test. Third, to enumerate the testing protocol for the community perform genetic test. Fourth, to demonstrate the correct method to perform a karyotype. So these are the like this, and you can see that in this learning objective, all the domains are included. Number of the student allotted are 4. Prerequisite for the elective, necessary immunization, universal precaution certification. So that's the important thing. So the also college has to make a small course of a universal precaution certification, like that, and if that student has done that, then and then only he is eligible to do the elective in that. So like that, the institute has to plan. Then learning resources for the student, departmental handbook. Then what are the activities student must do during these 30 days? First is work daily with a supervisor in observing, assessing and performing genetics. So with a supervisor he should work, not independently. Remember, then participate in a departmental educational activity. So there may be case presentation, seminar, like that. Student must get actively participate in that. Third, present at least 2 tests done by student in a casework. So like this, these are the example of a different student activities what he should participate during the this 1 month. Then portfolio entries, that he has documentation of worked up cases, documentation of presentation done, then logbook entry required. And after that, if that preceptor, that teacher is satisfied, then there should be the completion of the posting signed by the preceptor with meets expectation. So that remark must be there. That is meet expectation. Then how it is assessed? It is assessed by the formative. I already told. And important that there must be 75% attendance. Again, we have listed different activities. So the student has participated in day-to-day activities or not. So that should be there. If he is but then if he is done his work, then you can give that meets expectation. Like that, grade you can give. Then performance of assigned task, presentation of worked up cases in the department. So like that, what he has done day to day, you have to assess. And that assessment is the formative assessment. And in a logbook, there must be the grade that meets expectation. So that the these so institution has to prepare the like this template for each elective. So if the institution has chosen 20 electives, then they has to make the template like this. So this template is very important. You can take a screenshot of this, because I am going to give you that exercise to 4 to 5 groups that they should do the template on a forensic medicine related elective. So this is the important thing and heart or the important point of my today's session, that how to prepare the template for the elective. So these are the different points under which you have to prepare the template for a different electives. Next slide, please. So these are the examples of the general electives or block 1 elective, that is bioinformatics, tissue engineering, computer and computer application, immunology, genetics, human nutrition, sports medicine, laboratory science, research methodology, ethics, accident and emergencies, community project, HIV medicine, tissue culture, etc., etc. Next, the example of the block 2. These are the specialized or clinical posting. These are the cardiothoracic surgery, cardiology, pediatric surgery, gastroenterology, infectious diseases, geriatrics, psychiatry, clinical genetics, biomedical waste management, and lastly, related to our subject, that is toxicology. So these are the different example of the clinical electives. Yes. Next slide, please. So at a student level, it is difficult to choose. Then if at that college mentor is available, so mentor can help the student to choose the proper elective as per his or her interest. So at least 3 months before of the commencement of the elective, the list of available learning experience, that I already told that the institute has to select different elective. That list must be available at least 3 months before the commencement of the elective. When electives are scheduled, electives are scheduled the after the examination of third M.B.B.S. part 1 and before commencement of the third M.B.B.S. part 2. So these 2 months are there, and before that 3 months, at least 3 months. Actually, ideally, it should be available at the start of the academic year. but it's not possible because it's a new thing. Then at least 3 months before, all these elective information must be available. And what are the learning experiences they are going to learn, that also that information must be available. Then allocation of the elective may be done based on a student choice as well as availability of the resources. Again, uh, 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 again tell that the MCI or NMC has given this autonomy to the institute level, that they has to allocate elective depend upon the as a merit basis or first come first basis, like that. And it's the new thing. At first there must be 1 year must be should be after that only we will get the experience of that, what are the different administrative problems in that, like that. So the allocation must be done sufficiently in advance and the students informed that prerequisite for the elective. So why these 3 months? Because if they are allotted this 3 months before, then in that they can do the prerequisite, like I already told, that good laboratory practices, good research practices, CPR training if they want to do there in an emergency or casualty. So that sufficient time should be given for the student to do the prerequisite which is required for that electives. Next slide, please. Sir, next slide. So I already told about the external institution. If the resources are not available at your institute, you can do the MOU with the other external institution. So college can enter into the agreement with the external institute within the country to accommodate a student for undertaking an elective experience in both Block 1 as well as Block 2. And this there should be no conflict as per the rules and regulation of the MCI, now NMC. And remember, if that student want to do that learning experience out of the city or state, then remember that in block 1 clinical posting are going. So it's not possible out of the city in a block 1 to do the elective. It can be possible in a block 2, and but for this, if the student want to do in out of state, then they have to take prior permission of the NMC. So that is the prerequisite. If they want to do that elective out of the state, then prior permission of the NMC must be there. Next slide, sir. And for the importance is given to the student safety. So there should be avoidance of the student for the potentially hazardous situation, like that. Now here corona pandemic is there, so the students should be avoided to go to that specially structured corona hospital. So like this, the student should be avoided at a hazardous situation, and also must not get involved in a patient care as a responsible health provider. They will only observe or they will only assist whatever their preceptor is telling, but they should not do anything independently. And again, before starting, they should complete the prerequisite training such as good laboratory practice, universal precaution, good clinical practice, etc. And before that, one orientation program must be arranged at the institute level to give the information about the different electives. Next slide, please. Assessment. How this is assessed? I already told that attendance must be 75% or above 75%. Logbook entry and their submission is a requirement for the student to become eligible to take a final examination. And how the formative assessment should be carried out by the student has taken participation in grand rounds or not, has presented seminar, has presented case record, time to time submission of the assignment, or writing of the reflection, how the reflection must be written, that Pratik sir has already told, preparation of abstract for the research posters, not a total research paper, but they should able to after 1 month to write abstract whatever they have assisted or involved in the research, design and participation in patient education program, etc. So that at that elective, that preceptor, you have to make how you are going to do the assessment. So these are the some example you can include in your elective. Next slide. So curricular governance of the elective. The curriculum committee is the main committee of a competency-based medical education. We should This curriculum committee must meet with a dean, then finalize the different electives, then also discuss on design, conduct, implementation, and evaluation of the elective program. Curriculum committee consists of the 5 to 6 people, so they can take a help from a phase one and phase two subcommittees. These phase one and phase two subcommittees are mainly consist of the HODs of a pre-para clinical subject. So with that, with the help of all the HODs, because finally curriculum committee cannot govern all these elective. So day to day conduct of the program and guiding and supervising should be assessed by every head of department under which that elective has been planned. So like that, if there is the all HODs, then preceptor of the that elective, then curriculum committee, dean, if all get actively involved, then and then only this elective concept can be implemented as per the norms of a NMC. Next slide. So these are the different electives I thought related to the forensic medicine subject, that is forensic science laboratory. Usually these are in our Maharashtra state there are 5 science laboratory. So in that you have to make a MOU with the institute, and then only you can send the student for that. Then any research project related to the forensic medicine, emergency casualty posting where the medical legal aspects the student must observe, then mortuary posting, this is not given in a elective module but we can include that, and toxicology laboratory if available at your institute. So I request the groups who are not yet active, so they can prepare elective 5 groups. These are the 5 different electives I thought related to the forensic medicine subject. There may be addition in that, but for the active participation of a different group can make the template. Already I have explained on this, like a forensic science laboratory, research project related to forensic medicine, emergency or casualty posting, medical legal aspect, mortuary posting, and toxicology laboratory, like this. Next slide. So conclusion, what elective will commence after the end of third M.B.B.S part 1 examination and before commencement of the third M.B.B.S part 2. 2 months are given, and these 2 months there will be block 1, block 2. Student has to do both blocks. They will get rotated block 1 and block 2. Primary purpose of the block 1 is to provide learner with a research experience, and primary purpose of the block 2 that to explore experience in a guided patient care in a specialty in which he or she want to do his or her career. Then at the institute level, they has to select different elective depend upon the different teacher availability, resources available, and also they can make a MOU with other institute. Like that, all the whatever the elective selected by the institute, that should be displayed on a notice board at least 3 months prior, and so that if student can do the prerequisite required for their elective of their choice. So that is the summary of my session. I'm very thankful to Dr. Sanjay Bedi sir for providing this Pan India platform. I'm also thankful Dr. Sanjay Gupta sir, our leader, for this competency-based medical education, forensic medicine. Dr. Parmod sir guiding me for the preparation of this slide, and my friend, my colleague Dr. Pratik for assisting me. Thank you very much. Any questions are there that are welcome. Next slide. Next slide.
Sir, no questions and no hands raised, sir.
Any questions?
So we have one. No, sir, no hands raised, sir. No questions, sir. So do we have one more presentation?
No, ma'am. No more presentations, ma'am.
Okay, okay.
Thank you, Sanjay sir. Thank you, Nagesh sir. Thank you, Bedi sir. Thanks a lot for allowing us to
Thank you.
present, sir, ma'am. Thank you.
Thank you, sir.
Thank you.